I feel like these are blocked on my ears.
Now I
this
sound
week.
nasally.
Not as nasally as our one patient from
Just
earlier. I did.
You are live on Facebook.
Hi, Facebook.
Hey!
And you are now live on Instagram.
Cheers!
Welcome to Wind Down Wednesday again.
Happy Wind Down Wednesday, everyone.
So today's topic is post-procedure protocols. Melissa?
Yes.
Yeah, complications, protocols.
How to avoid them.
Yeah, and so I think the most important thing to start off with is no matter what I as the surgeon, we as the office, the patient as, a partner in this, no matter what all of us do, there is just no way to avoid the fact that some patients will get a complication.
It's the risk of surgery.
It is. And I remember in training, multiple times my attendings would tell me, if you're not getting complications, you're not doing enough surgery.
Right.
So if
We talked
surgeons
about
say, I have never had a hematoma with a breast dog, they just haven't done enough breast dogs.
But we didn't realize that for a long time.
Oh, and I still don't. And every time something happens, I think back about what I could have done differently, what I should have done differently, and that's good in a way to be able to push myself to always be doing the best technique and the most cautious. Yeah, and learn from mistakes, but I really did have to come to terms with the fact that you can't prevent every complication. And sometimes it's just going to be bad and everybody's going to be unhappy, but most likely we'll be able to work through it and get everything better as long as people understand this is surgery and it has risks.
All right. So what are some of the most common complications that you run into?
So thankfully, most of the complications that we have often are pretty minor. I would say the two things we deal with most often are wound separation, where the edges of the incisions pull apart.
Suture spitting.
And suture spitting is another version of that, where the dissolvable stitches under the skin will not dissolve, and they just poke through the skin.
Right.
Like a splinter. So that's common, and fluid collections are common after tummy tucks, body contouring, liposuction, breast surgery, and a seroma is a collection of fluid that your body makes. Everybody knows about arteries and veins. Arteries bring blood to an area, veins bring blood away. But in between, a lot of fluid leaks out of the blood vessels. And it's the job of the lymphatic system, our lymph nodes and our lymph vessels, to take that fluid back to the heart. After surgery, those vessels can be cut, they can be damaged, and they're so invisible we can't really avoid them in surgery.
Right.
So there just is a certain period of time where patients have to take it easy and wear a garment.
Protocols.
And that's something that can limit those risks of seromas.
Okay, so
go over
ultimately,
those.
why do complications happen as a general point of reference?
So as a general point of reference, I would say complications tend to happen because nothing in the human body operates 100% according to a predictable plan.
Right.
I mean, we used to joke about this all the time in residency, like the patient doesn't read the textbook.
Right.
Like people's bodies don't know how 99% of the cases usually behave, act, heal, whatever it is. So a lot of it's just chance. And there are
majority of the time it's not surgical error, it's chance or it's not following protocol.
Or a combination of factors. I always look for the one thing, and there's almost never the one thing. If we could pick that one thing, we would just not do it or avoid it.
Avoid so many of it.
Yeah. So
for personal error that causes it, such as working out.
So okay, we can break it down into three categories.
Yeah, let's
things
do that.
we as an office do to try to prevent complications, things the patient can do to prevent complications, and things that can be done literally during the surgery that help prevent complications.
Yeah.
So pre-op, we've developed a lot of protocols based on a lot of the highest ranked articles in plastic surgery for where there's a lot of evidence that good changes make things less risky for patients.
That's big though too that we do that because a lot of places just stick to the old, just constant.
Absolutely.
And we're always evolving.
Well, patients will say, should I take antibiotics after surgery?
Right, and we used to take them all the time.
That was how everybody was trained. In residency, you gave everybody with breast implants a week of antibiotics. Anybody that had a drain, a week of antibiotics. But they did a study called the NSQIP, which was the National Surgery Inquiry something, blah, blah, blah.
When we went to Chicago.
So that's when we found out about it, was several years ago. I think it was like 2013 or 14 or something like that. But they started the study when I was in training.
Yeah,
so it was a full 10-year study. And what they looked at was that patients that got a single dose of antibiotics before surgery had lower infection rates than people that were on an oral antibiotic for a week after.
Right.
And that's because the bacteria can get used to those antibiotics. So specific things like that, it may be counterintuitive to some patients,
But they change
we do
time to
follow the guidelines and what's based on actual research and evidence, not just, okay, this feels better to me.
So we can kind of dive into what we do for pre-op prepping for surgery.
Yeah, so pre-op, we have our patients complete what we call a decontamination protocol. It's probably overkill for some patients, but it doesn't harm anyone.
Right.
It's a protocol where we use an antiseptic body wash that you can get at the pharmacy and an antibiotic ointment that you can put in your nose and your belly button to reduce the risk that you'll have MRSA or one of those resistant bacteria.
Right.
Rather than testing everybody and treating everybody who's positive, it's simple and cheap and easy enough to do that we just do it for everybody. We also do a DVT screening. DVT is deep venous thrombosis. It's a blood clot that's deep in the legs, the scary kind that can travel to the lungs. So we screen our patients, and if we need to put them on some sort of blood thinner after surgery, we do.
Yes.
We talk to our patients very carefully about restrictions and garments and what they can expect.
And we also do clearances. We do a little bit overkill on clearances. So most places, you're young, you're healthy, you don't need a clearance. But if you're, above 40, you need a mammogram and an EKG. We, across the board, everybody gets a CBC, a blood panel. Everybody gets an EKG, no matter what age you are. And everybody gets a history and physical.
Yeah, and we have caught a few things, anemia and some heart rhythm problems that would have been better to know about before surgery.
Right. Yeah.
And wouldn't have been caught by traditional testing. So that's all the stuff we do before surgery.
Yeah.
During surgery, again, I could talk about it for an hour with all the different surgeries we do, but there are so many principles, again, based on research articles that I follow in surgery to minimize or hopefully avoid any kind of complication.
Yeah.
So a lot of it does end up coming down to how patients behave after surgery. So...
Or the hygiene, or how they take care of themselves prior to surgery. Diet,
your general health can be a big influence.
Yeah, even if it doesn't come up on a blood test, but if you're not diet, exercise, you're not taking care of yourself hygiene-wise.
You're not eating enough protein.
Right. A lot of that stuff can take into consideration. And you don't need to drastically change your lifestyle, but just, kind of... Because people always say that. Should I start exercising? Should I start eating a better diet? Should I start doing... No, don't go crazy.
But take a multivitamin.
Yeah.
Make sure you're getting enough protein.
Right.
And don't go on some crazy crash diet right before surgery or...
Binge drinking
right before surgery. So, though, breaking it down into categories, I do think that bleeding is something patients worry about a lot. We give everybody a list of medications to avoid. Some people just kind of blow it off and choose not to pay attention to it.
Like our guy with the neck lift.
Yes.
Who ended up in the hospital because he forgot to tell everybody that he didn't stop aspirin.
Yes.
Even though he was told till the cows came home that he was not supposed to take aspirin.
Yes.
And then he came out and said, sorry guys,
Oops,
I've been
I guess I
taking
should
aspirin.
have. Yeah. So... The other patients we've had with bleeding, I will admit some of it is just we don't know where it came from. It's out of nowhere.
Right.
But I would say at least 50% of our patients who have had bleeding after surgery either took medications they weren't supposed to beforehand or exercised before we told them.
Remember that excision we did on that back with the lesion? She drank the night before and just bled and bled and bled.
Oh
and
my
bled
gosh.
And bled. Yeah.
Yeah.
She's like, and then she just brought it up in the middle of it, right? As soon as we're in the middle, she's oh, sorry, I drank a bunch of drinks last night. Would that be a problem?
Yeah, so a lot of people don't realize alcohol is a big blood thinner.
Yeah.
And it can make you bleed after surgery and bruise after even injectables.
But you get pre-instructions. That's the big thing I think we need to touch on is that just being compliant and you're signing up for surgery. It is a surgery. It's cosmetic, but it is a surgery.
It's a real surgery.
And following the rules that you've been given. Stay inside the lines of the road. Don't swerve out because that's your own consequence when you swerve out. So I think that's going into some of that stuff. What would cause a patient maybe?
Yeah. So if we tell you don't work out for 2 weeks, don't work out for 2 weeks. If we tell you wear your garment day and night for 3 weeks, wear your garment day and night for 3 weeks, because many of the patients we have with complications, we know did something that they weren't supposed to do after surgery or before surgery.
Right. It's hard because you're going to feel good enough that you could do things.
A lot of people do.
But you need to still follow those rules and understand that your body's not healed yet, even though you may mentally feel better to do things.
No, definitely. And is it important to make sure there's people around you post-surgery? Or are you
that's a big
good to
one.
go? Because it's cosmetic. You feel like, oh, well, I got something done. I feel better. And then all of a sudden...
Well, just today we had a patient come in. She has been in for a consult. She's had 3 prior breast surgeries. So she's been through this before. She thinks she's an expert. And in some instances, she's kind of an expert when it comes to how her body reacts. But she was talking about where she was going to stay the night after surgery. And she asked her friend, oh, can I stay at your house so I'm away from the kids? And her friend said, well, you can, but I may or may not be there. We might be traveling that weekend.
Scary.
You need somebody to be with you the first 24 hours.
And that's
after
very,
surgery.
very common. I mean, there's so many patients who...
Oh, people have tried to pull one over on us.
People have, like,
say
said
they
that
need a ride
Uber
home and they get an Uber driver.
The Uber driver's like their brother-in-law.
Yeah.
You know, and been like, okay, well, it's no big deal. I can just put one over on them. But we've also had the patients who've gone home, fallen in a bathroom, you know, gotten a fluid collection because of that.
Yeah.
You have just had anesthesia. You just had surgery, regardless it's cosmetic or not. You're not in the right state of mind to make decisions or even to take medication on your own.
We've had patients take their pain pills, forget they took them, and double up on them.
Oh, yeah.
An overdose. So if you don't have somebody with you, you do run the risk of something happening that you're not in control of and may not even remember.
Yeah. So if you don't have a ride and you don't have somebody to be with you, don't have surgery.
As luxurious as we make it feel.
Yes.
It needs to be monitored.
Hire a nurse. You can hire a nurse. That is one of the things. So there are nurses to hire that, you know, are as cheap as a babysitter. So
I know one of the hard things for patients is they always ask up front, can I sleep on my side yet? Can I do this yet? They're so excited to be back to normal, but even though they feel it, but what is that going to affect the surgery that's happening?
So it's very different for different types of surgery. I'll be the first to say that even though I try to get patients to follow the same restrictions across the board,
everybody's different.
I'm a realistic person. And there's a huge difference for me between a 20-year-old having a primary breast aug, meaning an initial breast aug where there's no stretchiness to the tissues, no previous implant pocket that's too big, you know, nothing complicated. Those patients, honest to goodness, if you smoke a couple cigarettes, probably not going to be that big of a deal. If you don't wear your bra, nobody's probably going to notice. If you sleep on your side, it might not be a big deal. But you could develop more swelling on one side than the other. You could develop implant malposition with asymmetry. And for more complicated surgeries, you could really tear muscle fibers, damage things, pull a drain out. So...
Do you have a question?
Yeah, I do. So the question is, does she have the patient come in the day after surgery for a checkup, wondering for traveling patients?
Sure.
That's a good question.
We personally do in this practice.
But it's different. It's different surgery to surgery.
It is different surgery to surgery. So for our minor procedures we do on a Friday, those are things we can do under local anesthesia that are not major procedures. Usually we'll follow up with patients Monday. But we do give them our number, so if they have any questions or concerns over the weekend, they can call us.
We live right around the corner.
I have met patients at the office before. For our bigger surgeries under general, we do plan to see them the next day.
24 hours. If you're traveling, we usually make different accommodations according to you returning back home. So if you come and have surgery, we will follow up 24 hours, maybe like 4 or 5 days afterwards. Like we just had a patient who had surgery, we followed up with her 24 hours afterwards. We followed up with her then a week after on Wednesday because she was flying out on Thursday. And then we'll follow up with her when she returns back. So that was not the normal protocol, but we'll adjust those protocols based on the individual.
And I have some patients say they've had liposuction of 2 prior body parts.
Right.
There's not much we're doing that next day.
Right.
So those patients I've said, come see me in a week. So we do tailor it to each individual patient, but for out-of-town people, I do prefer to see almost everyone the next day. So most people will get a hotel room, stay to be seen, and then drive home.
And follow-up's different with everybody. You're more than welcome to come see us as many times as you like.
We have some people, actually one of our patients was like, I feel like I'm starting to become a member of the family because she always comes with her friend, and the two of them back and forth have been
the doors revolving.
Yeah.
Is there a difference between traveling in a car versus traveling on an airplane?
Yes, especially for liposuction and tummy tuck procedures and swelling. The pressure changes in the cabin can really contribute to swelling.
Yeah.
And with flying, there is an increased risk of blood clots in the legs
Double
compared
compression.
to a short car ride. Longer car rides, you just want to make sure you get out and walk around every couple of hours just to keep everything circulating.
I have a couple of shout-outs.
Sure.
So Courtney said, OMG, the ladies are awesome. The whole team is great. One day post-op, I feel good.
Oh, thanks, Courtney.
Oh, good. I know who it is.
I'm doing what I'm told.
Good.
Yes.
Hashtag Goldberg's team is the best.
Good, Courtney.
Dawn said she's the best. Hey, ladies.
Love you, Dawn. Can't wait to see you soon.
All right. So taking meds, when your body feels like you're ready to stop, should you stop taking the medication?
You can. So my guidelines for pain control, I like patients to be comfortable enough to take a deep breath and to cough without feeling like there's something going on in their entire body.
Mm-hmm.
I don't want people taking so much medication that they're too tired to get out of bed to walk around, and that they make themselves nauseated or constipated. So there is
too
a
much
fine
medication
balance.
that they feel like they can go like shopping in a mall 24 hours afterwards.
Correct. Or yes. Or there also is the phenomenon of some people, especially patients with a history of anxiety and depression, where they will take pain medication and Valium and get almost the opposite response to it, where they get really keyed up and anxious. And I've had patients request multiple refills for pain meds and Xanax and all these things. And in the end, when we just stop everything cold turkey and go to ibuprofen, people do better sometimes.
Yeah. I mean, we had we had a patient who was really hesitant about having her surgery, totally off the topic, but about meds. And she came in, but because she was so, like, not used to being on the drugs, she was crying, emotional. She's like, oh my God, take my implants out. What have I done?
Oh, her, yes.
What have I done? This is awful. Biggest mistake of my life. And finally, when she got the drugs, she goes, whoa, those drugs were bad. Because I'm really happy. And I don't know who I was for those last few days. So some people just don't do well on them. And they tend to get off them a little bit faster.
Yeah. Well, and I guess this is kind of off topic for the whole complications thing, but there is definitely a normal process after surgery, the whole grieving process thing.
And
people get anxious.
Regrets.
People regret surgery. People think they look terrible. It's really normal to go through that on a roller coaster for the first month.
Yeah. And we try our best to hold hands.
Yes.
And then also, like, registering what's going on with your body with the medication. Is it important to make sure you're checking your incisions rather than just not looking at them until they're healed?
So it's
kind of different.
Tough because I don't want some patients to be overwhelmed by the way their incisions look early on after surgery. And especially with labiaplasty, sometimes people tell patients just don't look for a week.
Don't look.
Because things
unless you're
look
bleeding
so
like crazy.
Distorted. Yes, but that's the
otherwise
other part of
let
it.
go, don't look.
Yeah, if there's something you sense is wrong, you shouldn't completely ignore that body part.
Right.
I guess when I say I don't look, I mean don't look in the sense of judging whether you think it's pretty or not in the first month.
Or if it's okay, or obsessing over it, because what somebody might think is not okay is normal.
Yeah.
Because it's just not, you're not a doctor, you're not in the medical world, so you really don't know. So that's why there's so much follow-up.
Yeah, and I answer questions all the time on Real Self where people are like, is this normal? Should my breast look like this? And I think, why aren't you talking to your doctor?
Right.
That's what your doctor's there for.
Yeah.
We talk to our patients as much as we need
photos if they need to on a weekend.
They'll email, they'll text, they'll call.
Yep.
We stay in close communication so that if you have concerns, you can run it past us and you don't have to make that judgment call on your own.
Okay. So then when these complications do happen, what's the next step in taking care of them?
Oh, that's why we put these pretty little things out here in the
Yeah. So depending on what the complication is, for most patients, it's not going to entail another big surgery. It's not going to entail a lot of extra expenses, but it may need a little extra TLC and several extra office visits. So as we mentioned earlier, one of the most common complications is seroma or fluid collection after liposuction, tummy tuck, arm lift, thigh lift, even facelift. You can get little pockets of fluid. So
what can cause that?
So again, back to the lymphatic system. When we do surgery and lift up tissue and put it back down, there's a lot of fluid that the body tends to absorb but may not absorb.
Mm-hmm.
So we have patients that say, I don't want to drain even though I recommend a drain. They're at higher risk for fluid collection.
And they're well aware of that.
We have patients that stay out of their garment. And this is what usually happens. They'll come in and say, I'm always in my garment 24/7. But you're not wearing it now. Well, I just didn't wear it for this appointment, but I'm in it all the time. So that happens a lot. And if that's your all the time, then you're
don't
really
post your
not wearing it all the time.
on Instagram and Facebook. Because we know there's not a garment all
Yes.
We can see you.
So, yeah, and we just had a patient travel this past weekend, and she admitted to me when she came back, she said, I was a little lazy about the garment, and she had some fluid. So it happens, and thankfully we can usually deal with it.
And we know the garments are a pain in the butt. They are not
they're
pretty.
uncomfortable,
they're
ugly,
they're awful, but that is the little area you have to take in order to get the great results. I mean, you just got to take that little bit of uncomfortableness to get there.
And this is my, I shouldn't say favorite, but it's a love of mine when it comes to liposuction.
She's my friend.
Yeah, it is my friend. It's called LipoFoam or Toppy Foam. And this is a sheet of really soft compressible foam that we can put under garments to provide really even compression or extra compression in certain areas.
I was going to say.
So thank goodness, I'm going to give a shout out to Dr. Barr, because he talked to me about using Toppy foam over seromas about a year and a half ago, and it has revolutionized treatment of seromas. People are
shout out.
twice as quick to resolve them with using Toppy foam over the site. Right. So now I even recommend patients getting lipo, just buy some ahead of time to be able to add compression in certain spots, and if their garment's cutting in, they can use it to pad that area. Mm-hmm. It's really helpful for preventing and dealing with complications.
Is it expensive?
No, it's super cheap. You can get on Amazon. They'll deliver it the next day. It's like $10.
Yes, it's dirt cheap.
And you can wash it and reuse it, but it's cheap enough.
Actually, most people find that it's more comfortable. Like, the more compression is more comfortable.
Yes, it's more support.
Right.
So.
Yeah. Here's this loveliness.
Yes. So this is what we deal with if you actually get a fluid pocket under your tissues. This is a needle. This is our syringe, and we will use the needle to get into the fluid collection and drain it out. This is why you want to be compliant, because if you're not compliant and you get a seroma, you're looking at this 2 to 3 times a week for
And usually everybody sits in a chair when they get it and they start hyperventilating, and they're like, oh my god, I can't deal with this. It is not a fun experience to have this.
It doesn't hurt because we numb the area, but it's stressful.
It's more it's mental. The mental part of it, knowing that like someone's drawing out fluid and it's blood-tinged color. So it's just not something you really want to go through and experience after you've already gone through surgery. Yeah. And it's usually, because...
and a lot of people, they either don't wear their garment, or they lied about smoking, or they're exercising, or, a
There's
lot of those
all sorts
things.
of components to
and
it.
I don't want to blame 100% of it on the patients.
Right.
This does happen, even when patients are perfectly compliant, and when I've done everything correctly.
Right, so not even with seromas. Seromas kind of happen here. So, like, in the breast... A lot of the things that can happen, because I was one of those non-compliant people.
So
I work here, I have rules, I understand them all, but I feel like I'm the exception to the rule. So, and I don't know how to not work. So, there's things that you do, like when they say stay home, rest, the biggest thing is opening and closing doors. Opening car doors, opening handles, lifting purses, using the purses. We always want to feel like we don't want to feel helpless, but there's a reason why you need to be helpless for a little while, because that is one of the biggest risks with the breast implants.
Yeah.
Is like fluid collection.
Fluid collections, and with breast implants, it even gets worse, because if you get fluid in there, it can stretch out your pocket and cause your implant to settle lower and farther out to the side. Or sometimes it can have the opposite effect and stir up bleeding, which can make your implant stick a little high.
Right.
So the stakes are higher when there's an implant involved, for sure.
Is there any, does physical activity affect tummy tucks? I've had a patient before came in and she said, oh, I vacuumed my whole house today.
Oh,
and
dear
we're
God.
Like,
yes.
Wait, what?
Yes.
And
so, again, on our consent forms, on our pre-op instructions, it says no push-pull movement for a bare minimum of 3 to 4 weeks.
So on that one, I had a patient today who was like, well, how are we supposed to know this? We didn't read our consents. Why would we not read our consent? I mean, why would we read our consents? We just trust you. There's a reason you're handed a novel of paperwork that has everything acknowledging at the bottom of it that you read and understood everything on the page. Do not ever go to a surgeon and blindfold and sign consents. There's a reason they're there for you to understand all the things that you're signing yourself up for. And the instructions. It tells you do not vacuum. Yeah. It tells you do not go do exercise.
Yeah. It's definitely something we work through with them as well. So any questions they have, we're happy to go.
That's why there's a pre-op.
At every follow-up appointment, we give a literal list of do this, don't do this. This is when you can do this. So it's
don't take that sheet
out pretty
and
clearly.
Just throw it in a purse and never look at it again. Yeah.
So what would you say is the number one thing you should not do post-surgery?
Get your heart rate up.
Yeah, heart rate up after surgery is the biggest one.
Yeah.
So no aggressively walking around?
Correct.
Nothing to raise your heart rate.
I remember years ago, Oprah Winfrey said, if you can say a full sentence, you're not working out hard enough. So I want people to follow the opposite rule.
Right.
If you cannot get a full sentence out, you're walking too fast, you're doing something too fast, you can do whatever you feel comfortable doing as long as you pace yourself those first 2 weeks.
So when are you done the recovery period? When is all that stuff you don't have to worry about it anymore?
So truly to encompass every surgery globally, you would say 12 weeks.
Yeah.
It's 12 weeks that your body could still be healing and going through this process and be more prone to fluid or swelling or whatever the case may be. It's most critical in the first 2 to 3 weeks for most people.
So we talked about different surgeries, so like the pushing and pulling for breast augmentation.
Yes, because we're doing a tummy and breast because we're involving the muscle.
So
a lot of them are the same though. A lot of them have a lot of them are the same. You don't want to lift anything heavy. Everything across the board almost. Nothing raises your heart rate. nothing heavier than like a gallon of milk. You shouldn't be lifting children. All of the surgeries kind of follow under that same protocol. Even a labiaplasty, because you can split your sutures. They all kind of follow under the same protocol as to like the first 2 weeks. Yeah. And no going in a pool, hot tub, ocean, all those in the same categories as having an open incision area. So in the first 2 weeks, tummy tuck's the only one that fall kind of a little bit further out from everything.
Yeah.
So what if I'm at that 2 to 3, 4 week mark and I think that I'm good enough? Should I go for it since it's
You should call your doctor?
Or should I ask
You should follow your doctor's instructions because we do tweak them for some patients. Some patients, I know I've done less liposuction, less muscle tightening or no muscle tightening, and I've modified the surgery so that they do have different restrictions. Or I know that they worked out avidly before surgery, so them doing a little light activity is not a big stress on their body.
Don't have a labiaplasty and have sex on week 2.
God, no. Week 3. It was week 3.
Oh, was it week 3?
I was just about to go out of town for my sister-in-law's wedding, and I got a picture of a torn open vaginal area on my cell phone saying, "We just had sex, what should we do?" The correct thing would have been not to have sex 3 weeks after surgery, since we said 6 to 8, but then we're left dealing with this kind of mess. So take-home message is follow the directions. Second take-home message, even if you do, unfortunately this stuff can still happen.
It still can happen.
But number 3, make sure you're picking a doctor who cares enough to help you work through those complications and not somebody who just says, you screwed up by, deal with it.
That is a huge take-home because so many people don't understand, like, if they've just gone down one road with one doctor. Across the board, many out there, it's not like that. Like, we go above and beyond to try to make sure that no matter what you're going through or happening, we will take care of you.
And that you're happy with
And you're
this.
happy. Because these things happen. They happen. It's not like it was done to
you. Yeah. And that's where it gets tough for me because I know I've poured my heart and soul into every surgery. And if something bad happens, I clearly didn't mean for it to happen. I don't want it to happen. And I did everything I could to prevent it from happening. So when people get adversarial and start accusing me of taking advantage of them, and if they're extra expenses, me wanting to get more money out of them, it really puts a damper on that relationship because we really do try to go above and beyond what is expected from most offices across the country and really try to take care of people.
Right.
Well, that pretty much covered most post-op complications. I mean, we got you covered with tappy foam and needles, but some of that's preventable. So
yes, and the other thing I want to mention is we do have a policy in place, Cosmetisure.
Yeah, that's
for medical emergent complications in the first month or 6 weeks after surgery. If you have to go to the hospital, if you have to go back to surgery.
The first one that we ever had back in the day, we had a patient who one weekend had a fever and was really concerned that the fever was correlated to the surgery. Maybe there was an infection. And I think it was like back in 2011, and she got an astronomical bill from the hospital. The ER gave the bill to the insurance rejected it, and she was like, oh my god, what do I do? This is like a $6,000 bill. And that's really when we looked into Cosmetisure, because even for something that's simple, that really wasn't related to the surgery, give somebody the peace of mind to get these treatments and things done to evaluations to make sure there's nothing wrong. And if there is something wrong, it can cover it.
Yeah. And the bummer is they don't cover cosmetic dissatisfaction. That's probably the biggest difficulty we have in the practice, because I can't promise that everybody's scar is going to heal beautifully or that people aren't going to have a little hiccup that affects their final result. And when people think, well, it's like a magic wand and everything should be perfect, and it's not perfect, so you should fix it, and just for the next 3 years, anything I want should be free, that puts us in a really tough position because it's not fair to other patients, and it's not, why am I taking on all the risk of you having a complication? You're choosing to have surgery, not me.
Right. It's so different than somebody needing a medically necessary surgery.
To me, that's a very different thing.
I had a medically necessary shoulder surgery. Did not go over so well. But I'm not blaming my doctor for it, and I'm not asking him to deal with it or do anything for it, because it just is what it is, you know? So I think people need to just understand you're taking on this risk because you want this outcome, but comes with that there can be some complications and risks that are involved, like everything else in life. Life lesson.
All right. Well, on that note,
happy Wipe Down Wednesday. Go enjoy a drink. When you turn it off, I hear like a little fuzz and ding in my ear.
Don't.
What did she say? And I think she said,
"Oh, the end shot was so cute. Y'all are smiling at each other.
Oh, okay.
It's so hard to get y'all simultaneously.
Oh, yeah.
Looking at each other.
Looking at each other and smiling. Because you'll be looking, but you're not smiling. You're looking at her.
like
and she'll be
paying
so
attention.
happy, and vice versa. And then, like, sometimes your eyes will close when you smile, and I don't think you'd realize it. And it's not cheeky. It's just they naturally, like, you just, I don't know.
No,
why it
I
happens.
I need more Botox here. I have a strong auricularis,
Stuff
especially on the
happened
right.
with my Botox. It swelled up my upper lid here, like really fat, and dropped it a little bit.
So a couple people have noticed in the past, my friend Lindsay, when I did
gets
it on her the first
swollen.
time. So I think what happens in some people is as time goes on, your orbicularis muscle has tone to it, just like sucking in your abdomen.
Right.
And if you relax it enough, and you've got a little fat or your lacrimal gland back there, if you relax the muscle with Botox, it all just comes
God, it's
pitching
just
forward.
so fucking
It'll probably be
puffy.
temporary. It'll probably be temporary.
Sorry, I'm trying to do this thing.
That's fine. Oh my god, I just said that's what's
Sorry,
fine.
there were so many things that I was like.
No, it was
they
cute. I
covered
love
everything.
I love you coming at us with the questions so we don't sit here and go like, what do we want to talk about?
I like that format much better.
It's just
Well,
it's
yeah,
more
and
interactive.
Honestly, I feel like I ask the dumb questions, which can kind of be a good thing. 'cause
Yeah,
I'm like,
people probably want to know.
so do you vacuum? No. Do you have children? No. All right, so I need ears.
Alright, I just set one on the table. I'm sorry.
We have ears. Say cheers. That's from Mickey.
Are you going back to Disney?
We have to. We bought 3-day passes and only used one day because the
Okay.
boys got sick. Well, Elaine got sick, whatever.
Is the camera still recording with this phone? It's
Oh,
going.
we're gonna so what?
The camera's still recording.
Oh, so
My slump.
It's just like that. All right.
At least I kept my legs closed.